Good morning, everyone. My name is Ina Lee. I'm a licensed marriage and family therapist. I'm a clinical certified hypnotherapist, and I'm a founder of New You Therapy Center and Family Services. We are located in Valencia, California. Today, we would like to present a webinar about ketamine or ketamine-assisted psychotherapy as one of the cutting edge or innovating technology to treat depression. And we thought that's really important to talk about depression today and anxiety, especially during the pandemic. We see a pattern of depression, or depression symptoms have been impacted a lot. Anxiety is rising, stress also as well. People's fear about the COVID, being ill from COVID, and especially for people that had some trauma in the past as well, their anxiety and depressive symptoms also have been impacted. So I would like to present to you today Dr. Beverly Reeder. She's an expert in TMS treatment and also ketamine or ketamine-assisted psychotherapy. Hello, Dr. Reeder. Good morning. Okay.
Hello.
So, Dr. Reeder, can you please introduce yourself?
Yes, hi. I am a psychiatrist, and I've been in practice for almost 15 years. I've done a lot in a lot of different areas of psychiatry, and over time, basically because I noticed the fundamental underlying cause of almost all psychiatric conditions stems from, in my opinion, from a history of trauma, sometimes within the patient's own life and in their conscious experience, and other times something that they may or not be fully aware of, and then also generational trauma as well is a contributing factor. And then over time, in the last 5 years or so, the increasing use and exposure in my own experience with ketamine and other psychedelics to enhance and increase the ability to access these memories and to work through traumatic experiences and improve depressive symptoms in a way that previous treatments that we've had, haven't been able to really do it. So I've just become a really big fan of these treatments because after so many years in practice, I'm just very impressed with the different level of access and healing that they can provide. So
that's very interesting. So you can talk about your clinical experience, but you can also talk about your personal experience from both sides, so people would know what to expect, what to experience. And by the way, I forgot to mention to people that to stay until the end of the webinar. It's going to take about an hour. We're going to take some questions at the end, and I'm going to tell you also how to contact us and schedule a free evaluation for ketamine-assisted psychotherapy just to see if you qualify. So stay until the end. So we have prepared some power slides for you. So it's going to be just easier to see and embrace some information. Just going to start the presentation. Okay. So ketamine-assisted psychotherapy, Dr. Reeder, what is ketamine-assisted psychotherapy? We call it shortly CAP. So what is CAP? What is that for? When do we use it?
So traditionally, ketamine's been used. Most people think of it along the lines of the IV infusions for treatment-resistant depression. And it was basically an uninterrupted process where patients underwent the infusion, usually 40 minutes of a steady stream of ketamine, basically an inward experience that's very psychedelic and causes basically with a repeated series of treatments, a sustained response of an antidepressant effect. And all of that is true. However, what has been revealed is that during that same process, a lot comes up during the 40 minutes. A lot of imagery, a lot of memories, so to speak, can come up. A lot of events related to the present day that are occurring, and then maybe some like sort of snapshots related to past events that may or may not make sense to the patient, but seem to be related, as well as sort of a loosening up, if you will, of a patient's sort of defenses, and both depending on like the dose and their state of awareness within the delivery of the drug in the moment of the ketamine experience, and then also 12 to 24, 48 hours after. They have a better ability to process things and talk about things that otherwise were sort of kind of kept in a less, in a more unconscious place. So through that sort of revelationary process, both myself and obviously many other physicians that came before me started to put all this together and develop a more formalized protocol of looking at this and how can we use this phenomenon effectively to help patients better. And so that's basically how it emerged.
Right. And so this is a legal use of psychedelic medicine, right? You're saying that is proven to help treat right now the depression, a really like resistant depression, when people have gone through multiple treatment modalities, traditional psychotherapy, medication, even TMS, and nothing really helped, right? So people can go and seek for help for ketamine treatment, or ketamine-assisted psychotherapy. And that also helps to treat severe anxiety, even OCD and PTSD as of right now. And I can see on the slide also that it can be offered in the comfort of home or in the office as well, too.
Yes. So it doesn't have to be just so the use of CAP doesn't have to be only for treatment refractory, though. Like CAP can just take your treatment to another level, as well as all the way up to being something that can be useful when, a lot of other things have not helped.
That's interesting. So there's a list of benefits of treatment that you wanted to talk about, and can you talk to us about each of them?
So I've touched upon some of them already. So like shift the mind, open the new doors. That's a nice way to put it. New doors, enhancing neural pathways. So it does that. It just sort of there's a lot that goes on that we don't completely understand with the use of ketamine. It's a glutamate modulated process. It does a lot of things at the same time in terms of activating different neurotransmitters, increasing blood flow in the brain, causing growth of new dendrites and new neural pathways at the same time. There's like many different things going on, and we don't really understand all of them, but they're all contributing to this process that during the experience and then cumulatively causes this, progressive shift within the mind. And it allows for two things to be occurring. One, this loosening up, so to speak, of rigid defenses, if you will, psychologically, that allows for some processing of things that, otherwise have been hard to process in a conscious form with just talk therapy per se.
Yeah.
And then also this biologic process that allows a bridging, a more malleable neuroplasticity to start to take place, of the bridging of new neural pathways, of better reframes around traumatic experiences. to create, more positive thinking.
Mm-hmm. So that's an interesting combination that we talk about. And I know you're going to talk about the difference between the IV intravenous and then intramuscular, the shots. And now as well, this ketamine-assisted psychotherapy came out as an innovative new modality where you combine the biological component of ketamine, right? Which is by itself, it's really helpful. And you're going to talk about the biology behind it, or psychopharmacology. But at the same time, people have been using in combination of psychotherapy when the subconscious mind is available to, as you said, neuroplasty, being just flexible, I guess, to work with neurons and work with chemistry as well, and just having access to subconscious belief system. So that at the same time is giving the benefits. This is my understanding of it. If there's anything that you can add to that kind of component of understanding.
Without getting like super biochemical.
Right.
Yeah, that's like a fair basic understanding. Yeah.
Okay, that's interesting. So can you talk about a little bit of a history of where it's coming from, how it's become ketamine, and then why we started to use this ketamine in the medical field and the mental health field as well?
Yeah, so ketamine is, I don't know, it originally was FDA approved for an anesthetic. It's a very safe anesthetic, which is why it became very popular. Used originally in field medicine, like in the military, because it didn't require, extensive monitoring like typical anesthetics do in the operating room from a cardiovascular perspective. So, it's very predictable onset, very predictable wear off. So it could be used in the middle of a field when you needed to anesthetize someone for pain and do a quick procedure and then have them come back, to consciousness relatively quickly. So it was used extensively in that setting. That was originally its purpose, so to speak. And along those same lines, it was also used in pediatrics for a lot of the same reason. Just need quick anesthetics sometimes for children to do quick procedures, because you wouldn't put an adult to sleep necessarily for a certain thing, but you need to put a child because they won't, they can't move, and you need to keep them from moving. So those were its two main uses for a while. Then around the 2000s is when it started to come to light that when you use these sub-anesthetic doses, so like in general, you can approximate like 10 times less the dose used for anesthesia, that if you did this consistently, and what was found was that this series of 6 was this sort of tipping point. So approximately 2 to 3 IV infusions of 40 minutes over the course of 2 to 3 weeks. That caused this decrease in treatment-resistant depression symptoms. And a lot of stuff took place, like as you can probably guess, probably in the VA settings, because that's where they do a lot of these more like cutting-edge type. What can we do to treat these guys that get these serious mental health issues from PTSD or depression related to, exposure to like situations that most normal human beings aren't exposed to.
Right.
So
it's interesting that you're saying that VAs or veterans have been using that a lot to treat their PTSD, right? PTSD symptoms. And what's a lot we see in combination, it's a kind of comorbid combination that people have PTSD, and then chemically they would develop a depression as well. That would go hand to hand. And a lot of time PTSD, because it's under the umbrella of anxiety as well. So they would suffer from anxiety at the same time. So could be multiple symptoms going on at the same time. Right. So can you talk a little bit about the psychopharmacology and the difference between the IV, the IM, which is the shot, and then the lozenges is the lozenges we use in the ketamine-assisted psychotherapy modality.
Yes. So they're just different methods of delivery. And basically, there's different, reasons from a practicality, efficacy standpoint, and reasons why you would want to use different methods, and then bioavailability. And I'm sorry, I homeschool my children because of COVID, and one of them is at my feet. Yes? Mm-hmm. Okay, we'll have to look for it when I'm done with it. Okay. All right. So IV infusions, as I mentioned, were sort of the traditional. That's what patients think of. It's a steady state. Obviously, you receive 100% of the drug. It's over 40 minutes. That's the traditional amount of time. Patients typically don't talk during that. It's a mg per kg dose, weight dependent, and you typically dose the patient to a point where they're pretty out. It's the experience of the drug in the most biological form. So they're pretty subdued, and they're not really able to carry on a conversation. That's where you sort of let the drug do its thing. And that's where you want to debrief with them, so to speak, in that 24 to 48 hour period afterwards, where they have everything sort of gels and comes out of what the experience was like for them. And that's where the processing and the therapeutic component is very helpful. The intramuscular form is sort of from a practical standpoint in the sense of cost effectiveness, because it requires much less supplies, and is easy to do in terms of quick and efficient. It's 93% bioavailable, so it's pretty comparable. Mm-hmm. It doesn't have a steady state, though, obviously. It's a quick release and it's a quick wear-off. So it's not the same as the IV infusion from that standpoint. But you do also have the ability to obtain the effect of an intense experience of the drug biologically, and the ability to then process the 24 to 48 hours later again. Mm-hmm. That's come in handy during these COVID times where not everybody has access to the IV centers and that kind of thing. Then there's the other modalities. The one that's probably the most popular has become the lozenges. That's because the compounding pharmacies can make a lot of different forms of ketamine, intranasal liquids, and lozenges is one of them. And those are just kind of like little cough drops. They dissolve under the tongue, and in about 10-15 minutes, they induce an experience with the patient that probably about half the time results in just a very loosening up of that patient's sort of consciousness to a place where they very easily and effectively can talk through very difficult things emotionally in a much, much easier way. So they, in the moment, can do a lot of very effective processing. Mm-hmm. Sometimes I would say the other 50% are quieter during the lozenge experience and would talk after the fact more than during. So it's kind of patient dependent.
So, okay, so during the ketamine-assisted psychotherapy, we use lozenges, so we talk about trophies, right? And you said we put it under the tongue for 15 minutes, it dissolved, and then people can have an effect of the ketamine, while at the same time, there's a therapeutic moment, therapeutic process is going on and healing as well, too. And I'm just wondering if you can talk about the clinical as an expert and as well personal experience. How does it feel? How does it feel to be under the influence of the ketamine?
Yeah, so I'll try to put it into words. Obviously I heard it described to me a lot of times, and then it's encouraged that as practitioners, we all experience it as well. And we have these, clinician experiences where we have an experience of the drug too, because it's one of those things that it's just very helpful to understand who it would help if you also know what it's like. So it's a psychedelic. So there's a lot of visual hallucinating, sort of like a kaleidoscope kind of feeling, like being immersed inside of a kaleidoscope with a lot of visual imagery and, floating rainbow type, pretty sort of psychedelic, like what you would picture in a psychedelic poster or something of very colorful imagery and clouds and what. It's a very spiritual like experience, sort of a very connecting like feeling of calm and connecting, that things that seem intense and worrisome don't matter. Mm-hmm. A shift in perspective, so to speak. It's very, if someone goes into a ketamine experience feeling very suicidal and horrible, they typically come out of it feeling none of that. Patients describe sort of this feeling of oneness, like with nature and other people in general, just sort of feeling like this interconnection with life and the world. There's a lot of reported imagery of nature in some of the imagery as well, like trees and grass and fields and flowers and things like that. There's a pretty significant sense of disassociation physically, mm-hmm. meaning you have a sense of not feeling in your body, feeling of like touching your hands, but you don't feel the sensation of the touch as much. That's very meaningful from a trauma processing perspective, in the sense that one of the reasons there's a lot of block to processing trauma is because it brings up a lot of affect, a lot of physical and emotional and psychological pain. And the body's defenses, conscious or unconscious, are to suppress that from a survival instinct. However, that disassociation allows for a bringing up of those memories, because there's a disconnect between those feelings now. So it's almost as if you're watching a movie, so to speak, of the events. You don't feel the same level of pain that you felt while experiencing them. So it allows for a processing of them in a new way that can be incredibly healing. From that point, you can feel some level of physical experience similar to the event, but not with the same, physical pain. Is much less. And so that's really remarkable. Mm-hmm. There's the feeling of the floating around, like when I said the clouds. So it's sort of this unique mix of just being out of the body, but also having memories, snapshotted memories of some of the experiences of being in the body, and this kind of merging of the two things, which is some of which people will talk about during the experience. And then, like I said, some of which people will just kind of remain inward experiencing it. And then like a day or so later, just have like a flood of discussing them. And that sort of depends on the patient and the dose and sort of different factors. Mm-hmm.
That is really interesting. It really sounds like a lot of times when I do hypnotherapy with clients, when they achieve a level of subconscious processing and meditation as well too. Say they feel that they're floating, and there's access to the subconscious belief system that you can work with. And I'm assuming that's because the defense mechanism is down, and you can work with belief system. There's it's chemically looks like there's like in vivo desensitization is happening as well too, that previous trauma, maybe association. We can have multiple traumas in the past, right? Not necessarily you need to have a PTSD. We can have different trauma, like grief right now, what's going on during COVID, or even our childhood, right? Or it could be work exposure. Anywhere that you can go, it could be very traumatic as well. And people can experience severe anxiety or depression. That could be very helpful as well. It looks like there's a biologically it's going on the neurons way and level. There's a healing on that level, and there is also a subconscious level, right? It is a beautiful feeling physically people have been experiencing. But where is that the psychotherapy? Psychotherapy comes in, and what level? How does it interact with that ketamine process? And the question is, why is it so effective versus just a traditional psychotherapy?
So, I mean, so there's two. So one is like, so if you have a patient that's like, you just have to kind of meet them where they're at. So some patients, during the process of doing the ketamine, for example, you give them the lozenges, and it's within 10 minutes, they're just very much super loosened up and super talkative and super emotional about whatever it is that they have that brought them in there, whether it be a history of intense abuse, the loss of a child, whatever it is for them, they just start becoming incredibly emotional talking about it and just crying and letting it out. Mm-hmm. And it's different than in a talk therapy session. They don't let it out in a cohesive, ego-driven, controlled manner. They let it out in a almost childlike, intoxicated. They seem like they're drunk when they're talking. There's some tangential talking. It's a little bit. It's very tangential, and it'll be very, not always make complete sense, and it'll spring from topic to topic, and trauma activates other trauma. So the loss of a child will then go on to talk about the loss of their mother, and then that will go on to talk about their marriage that isn't happy, and then that'll go on to talk about how they feel at their job that makes them feel like a failure, and then they go back to talking about the child, and then they start crying, and then it just allows this really large catharsis that they otherwise would more than likely. They may have touched upon those things in therapy already, but it was more controlled. It wasn't to that. It was more guarded. It was more. It wasn't to that degree of like, free fall of letting it out. They'll cry. They'll scream. They'll just really release it. And then you just use that and guide them and let them know you're there, hold their hand if they need that, remind them that they're safe, tell, whatever they need in that journey. And then I write things down that seem important to follow up on during the conscious state a day or two later. If there are things they mentioned that I wasn't aware of already, I make sure I write those down. You touched upon your mother's death. You've never talked about that before. Mm-hmm. You kept bringing up this imagery of this field with trees. What was that? And it might be somewhere they spent a lot of time with as a child or something, so you just, you use it. It's just a lot of information. It's sort of like a very accelerated, it's probably like 30 therapy sessions in one. You just get all the information you can from that time. And then the other extreme would be my patients who lay there very quiet, don't say a peep. And I just check on them periodically, just how are you doing? And they just don't really offer much of anything. And then I ask them to journal when they go home. And then a couple of days later when I talk to them, they're nonstop with what was going on. I saw these clouds and I was floating, and then I saw this, and then they just open up and share everything that they went through. And then we use that as the launching pad to discuss some very difficult topics. So, so it works either way. I just trust the medicine to prompt the brain to prompt its own natural healing process. Because I think that that's innate within us. It just needs a little bit of a push. And I think the drug does a really lovely job of giving it a little push. And then I kind of take it from there.
Mm-hmm.
Well, me, I don't try to intervene too much. I let that guide me.
Yeah, it sounds like also as well, just the presence of, a clinician of psychotherapy is healing by itself and safer as well. And I just wanted to remind that can be done from home. So the lozenges can be delivered to the patient's home by compounded pharmacy. And that you can have psychotherapy while you're taking ketamine lozenges, basically by just virtual teletherapy, right, or psychotherapy at the same time. Not that you being observed by a psychotherapist as well and taking maybe some notes for you. You're saying that you're meeting then in a couple of days with a client, with a patient to process consciously now their subconscious process or feeling or experience that they had while they were under the ketamine influence. Is that right?
Yes, correct. That's been like a accommodation, so to speak, that for COVID was the transition of doing it virtual. Mm-hmm. So basically doing it like this, like having the patient in their home and just guiding them through the process virtually. Mm-hmm. You just aren't there to hold their hand. And for some, that's fine. They're okay with it. They still want to have the experience. And just knowing that, hearing your voice, having the music playing in the background, setting the scene so that it's very comfortable, that kind of, that is enough for them. Mm-hmm. Yeah.
And what beneficial might be also as well, just being as a psychotherapist working with conscious mind and being a hypnotherapist that we work with subconscious part. That it looks like this modality is giving you access to both yet at the same time. So you're working from the ego perspective, with conscious kind of thinking, and then subconsciously when the ego is down, you can have an access to the subconscious belief system. So you kind of desensitize them. So when you come out of that treatment, even after one session, a couple of sessions, so the triggers are not there, right? The association is not there. So the reaction to those traumatic or depressive symptoms are not there. And I think that's really, really powerful. And maybe that explains why the CAP or ketamine psychotherapy, that combination works more effective nowadays than just traditional modalities, right?
Yes. I mean, it's like in my opinion, it's, I don't know, somewhat comparable to like doing EMDR, but with maybe some more kind of rapid results, so to speak. Mm-hmm. I mean, you can definitely merge the two. It's very complementary to any other type of therapeutic process, and it can be. It can be like an effective, I don't know. I don't want to be like, it's not like the McDonald's of getting better, but like it's just a really nice tool to access. It still takes time to heal from traumatic events and to move through things, but it's just it's an avenue that kind of shakes things up, in my opinion, and makes it more, I don't know. It's just another level that's, in my opinion, kind of exciting because it seems like it's like a breakthrough.
Right, like internal subconscious breakthrough, inner healing, I would say. adding to the cognitive work, plus the biological component again, and that's feeling well. The neurons are working and kind of connecting at the same time and producing chemistry in the brain. That's a combination haven't been accessed before. That's interesting. But what about the side effect? Can you talk about, like, is a ketamine or CAP is safe?
So the side effects are what we're using. Mm-hmm. So see how it says side effects and the side effects are what we're manipulating, right? The side effects are the hallucinations and the blah, blah, blah. So I extend the list of the side effects to include like sort of that intoxication aspect of it, right? Like people seem, they have slurred speech, they're confused, they don't talk very much. This is when you get into the higher doses, which is where they don't talk very much during the experience until after, right? Mm-hmm. So that's where people are more quiet. The drug wears off. That's during the period of the drug. The drug wears off in a very predictable manner. So once it wears off, that sort of slurred speech, confusion, seeming intoxicated, not talking very much, the ataxia, that sort of seems, that kind of like just stops and then they're fine. I still want people to not drive home, mm-hmm. But they pretty much return to normal otherwise. During the session, this isn't true with the lozenges to the same degree. During the session, we check blood pressure and make sure they're not getting, their heart rate's not going up too high, that kind of thing. Nausea is probably the biggest problem with it. And lozenges tend to create a little bit more nausea. If patients need something for that, I'll give that to them beforehand. And then I just want to make sure patients are healthy. If we're doing it on an outpatient basis, especially virtually, I want to make sure that patients are healthy beforehand in terms of having a baseline physical exam, lab work, EKG, just that they're cardiovascularly stable and that that the drug will act in them in the predictable manner that I expect.
Mm-hmm. Yeah. So, is any medication as well to have a side effect that you do want to get like physical evaluation for, just to make sure that you qualify for this treatment, right? The question is that really safe? Are there any addiction risks? Of course, we all want to ask, and that question we want to know. Is there any possibility, even for people that have been using maybe substance use?
Yeah, so you can't be using drugs present day, obviously, and a history of substance abuse. It's not a contraindication. It just kind of, I just have that in my mind that may play a role in the dose that someone may need to have an effective experience, but it wouldn't preclude them from having it. Being eligible, meaning the long-term side effects, there aren't any that we have knowledge of to date, that research has shown to date. The biggest problem, so to speak, with ketamine use is that it's not sustainable for treating depression, right? So if people respond to getting ketamine for depression, they typically need maintenance. We don't have, in studies that are following people 2 years, 3 years, 4 years, 5 years out, they need to keep getting it. Mm-hmm. They need to keep getting it every month or 2 months or 3 months, whatever their maintenance schedule looks like, or their symptoms return, and so that just kind of is what it is, right? That's the biggest problem with it, so to speak. But it's not a permanent solution. Mm-hmm. I'm not sure if anything in life is, but it's definitely something you have to keep up. Addiction, honestly, it's a controlled substance. It's really controlled. It's we can't distribute it. It's not like Xanax even that we can give a prescription for to people. The only thing I can prescribe it for is I can prescribe the lozenges, but even those I just give 20 at a time, which is an amount that is sort of a standard of care that most of us do, because that's not a distributable amount. That's not really an amount that you could do very much with from a abuse standpoint. That's a monthly amount. So it's pretty, I don't really have none of it. That's not really something that's come up. The history of abuse with ketamine is along the lines of, other psychedelics and sort of the situations where most drugs of abuse come up, and that's basically dose and environment, right? So it's large doses of the drug and in an environment that elicits excitability. So we're using small doses of the drug in a very calming environment. When you use large doses of the drug in a very excitable environment, like a club with loud music, you elicit just very intense elements of the psychedelic aspect of the drug. And that's mostly it, right? And then you elicit that in a very short period of time. And so that's the abuse aspect of using ketamine, right? So that's really an apples, oranges kind of comparison in the way in which we're using it in this controlled manner for a therapeutic benefit.
Okay. Can you talk a bit who qualifies for the treatment and what's the basic qualification? I know that you said that people have to go through physical examination and labs, and then you would also evaluate them. But in general, so people would know age, maybe any contraindication that we're going to talk about later.
So major depression primarily without psychotic features, just because psychosis is a contraindication, just because of psychedelic aspects. PTSD, very, very helpful as well. And then the suicidal ideation, like I mentioned earlier, that's something that I think of ketamine for, like right away, like to keep people out of the hospital. That can be a very helpful treatment. Go-to treatment is to use ketamine for that. There's also evidence, increasing evidence for OCD, anxiety, and to a lesser degree, chronic pain. There's more and more evidence coming up, and it's used a lot, like in New York City and so on, in substance abuse treatment centers. There's sort of some mixed opinions about that. I don't do that personally, but as I mentioned, I will do ketamine though for people with a history of that. It's just sort of case by case, and just kind of see how it goes. So there are treatment centers though that use it in the manner of to recover from substance abuse issues. So that's a different thing.
Right. Usually it's mostly for depression, PTSD, severe anxiety, or stress. What's important that suicidal ideation and any of the treatment modalities available in our clinic, for example, TMS, that we don't use TMS for people with active suicidal ideation, versus ketamine can reduce the suicidal ideation, right, for some time and save their lives.
Yeah.
Okay. And then the contraindication. Patient who will not be a good fit.
Yeah, so if you have any sort of unstable cardiac condition or hypertension that's not controlled, active thyroid disease that can contribute to unstable cardiac issues, active drug use, active psychosis. Bipolar depression is appropriate, but not if there's a current episode of mania. And it's contraindicated in pregnancy, so you can't be a pregnant woman or breastfeeding. And if you're a woman of childbearing age, if you're going to be doing consecutive treatments over a period of time, you need to be on birth control of some sort.
Okay. And that's why we need the physical evaluations. So just shortly, if you can tell us about the medical clearance.
So that's basically establishing the diagnosis that's appropriate, like we've already talked about. baseline level of symptoms being appropriate, that, just going over medications people have tried, their medical health and clearance of medical illnesses, and that their safety from that standpoint, and then their overall baseline health, in terms of making sure to the best of your ability that their response to the drug would be the predictable way that you would expect.
Mm-hmm. Okay. Well, expectations from if it's done in the office or being done virtually at home. What should people know about that?
So I tell them to allow the 2 hours, right, of like sort of the process. For the lozenges, it's, I've seen anywhere from like 5 minutes for it to kick in with someone to like 20 to 30. 15 minutes is probably like an average. And then once they start to wear off, it's kind of a similar thing, anywhere from 15 to 30 minutes. And then once they wear off, it's kind of like, it's a little bit of a slow wear off initially, and then it just sort of happens. And so they just kind of lay there quietly for a little bit, and then they kind of wake up and have a sandwich. So it's really, so in an outpatient setting, they'll sometimes sit in the waiting area for a little while and then be ready to go. At home, obviously, it's a much easier process. I don't like patients to be alone if they're doing it at home. So I'll make sure someone's in the other room. Unless I'm going to be with them virtually the entire 2 hours, but that's kind of, that's variable, sort of case by case. Depends on sort of if it's their first time or seventh time, we sort of kind of feel that out. Mm-hmm. And then no food 2 hours prior because of the nausea, because of the fact that it is an anesthetic, and anesthetics can cause nausea. I don't want anybody vomiting or anything. And then if you do come out, I don't want people to drive home. So I like them to have a ride the first couple times, and then after it's a predictable sort of situation for them, and they're not, they kind of know how it feels and what it's like, then they can take a Uber or Lyft or something.
From being home, but at home they would need to have somebody just to be available, for the safety part. No, but it's beautiful again that it's accessible through any geographical location. We're in California, of course. Within California, we can work with ketamine-assisted psychotherapy. What is the success rate? What's interesting, I know, like in general or by any research or any numbers, that data it's available. And what, in your experience, what's the success rate of people having respond to this treatment?
So there's bias because, when I select for CAP, I'm selecting like with bias of who I think will benefit. So it's quite high because I select based on, it's usually from a pool of patients that I anticipate would do really well, versus like IV ketamine infusions, like that's pretty high still, but there's still going to be failures amongst that because it's not quite the same selection pool. So with treatment-resistant depression, and when you're doing just IV infusions for ketamine, it's still quite high. It's still probably like 75%. So I would say when you integrate the therapy component, it's probably greater than 80% because you select like maybe even higher, but in medicine I'm just afraid to state anything higher because then it sounds like some sort of guarantee. But it's just it's really effective. It's really helpful for people.
That's a really high number, over 80%. And I know in our center, we have added some perk to people besides individual psychotherapy. And also, besides having access to ketamine lozenges as well at home, they have access to group therapy and the coordination of the treatment. So the coordinator can work with multiple components of clinician. So the client by itself doesn't have to go on the run and just have access to different people, But is it covered by insurance?
No.
It's not covered by insurance.
Yeah, no, I mean.
So basically, it's a out-of-pocket expense. Even though it's an out-of-pocket expense, the success rate is really high. So I guess the information is available for people just to think about it. What would they like to spend on a traditional psychotherapy, traditional medication, and that approach, or something again that ketamine-assisted psychotherapy for people that nothing worked for really, or not much improvement, so they want to try ketamine-assisted psychotherapy. And the financing and financial plan is available also as well in our center. Can you give us really a short example of your maybe one success story?
So let me just caveat though that one answer I just gave it basically like so the name itself, ketamine assisted therapies, that's not going to be covered by insurance. However, there may be a way to do some sort of billing for the therapy hour on with an insurance code. I don't know. I try to stay out of that information area. So I don't know, but it would the entire process wouldn't be covered. But it's usually an out of pocket.
It's usually, so I guess that people can get super bills and see if the insurances might cover up psychotherapy parts, just to help financially. Okay. Dr. Rita, do you have an example of maybe a case or success story, how one of your patients were treated and how the symptoms, have improved?
Yeah, I mean, there are many. I just don't want to divulge anyone's personal information. I'll just use a general example that's not even my patient. It's like a colleague's. There's cases and cases of basically patients with really significant complex PTSD and history of abuse, and like childhood abuse that really is on the level of severity that is wondering if someone could really even recover from that level of severity and prolonged abuse. And we've been able to see that with maybe like a year or so of regular CAP sessions, once a week, that this patient was able to start to talk about these intense abuse sessions little by little. When she had started out not being able to even talk about them, she was able to start talking about them, to start processing them, to start releasing them, and to work through them to the point where the sessions moved to every other week, then to every few weeks, to monthly, to where then she just started coming every 4 to 6 weeks or so, to then moving into a place of being a relatively functional adult. I just find that very profound. When you have a story of someone who having worked in countless like residential treatment facilities over the years and girls' homes and places where you see girls who, were just set up to not be able to ever be functional adults based on the level of abuse they underwent. And this was a girl in that category. And to see her be able to, with focused therapy of this type, and the ability to do it on a regular basis for an extended period of time, to see her transform. I mean, I think that's like a miracle.
It is a miracle. It's just giving hope, I guess, to people that, again, lost their hope. Nothing worked. They tried, again, different treatment modalities. There's a slight improvement and no improvement at all. So that might be, and again, they've done maybe even TMS and transcranial magnetic stimulation treatment, nothing works. So they can try ketamine-assisted psychotherapy alone together just to see if that might be helpful as well. So I don't see any questions here for people. If you want to ask any questions, just go ahead and put your question in the chat. And I'm going to wait here for just literally a minute just to see if your question is going to appear. If not, I'm just going to put a summary of today's webinar. While you may be thinking and putting some questions, so the summary is here is ketamine-assisted psychotherapy is a combination of ketamine by itself that's giving biological access to improve and heal some neurons, right? And as well as giving your healing subconscious to the subconscious belief system. And also it's reducing the reaction to the triggers, but it's also giving you access to your conscious mind. Yeah, so it's kind of you working on a 3 level, right? So that is increasing the success rate from this treatment. So it is a short-term treatment. It's between 6 to 10 sessions altogether that you're going to be able to see a significant improvement. Dr. Reader says it's over 80%. That helps with resistant depression, major depressive disorder, any kind of trauma, or PTSD, anxiety, OCD, severe stress, right? And the most important is suicidal ideation. It helps with cases that didn't improve after traditional treatment. There's no long-term side effect. Okay, let me just see here. There's no long-term side effect or additional risks. It is mostly for patients over 18 years old. Patients need to have a physical evaluation or labs before the treatment. It is not covered by insurance, but financing is available, or there's a payment plan. It's available in our center, and it can be done in office or from home. It's really convenient geographically. It improves daily function, right? It just people have to remember this. It's giving you hope. People can feel better, can smell again, can touch. They can improve their career, relationship, and just ability to even enjoy their life. And as a perk in our center, just again, we are providing additional groups and treatment coordination just to, I guess, increase that effect of ketamine-assisted psychotherapy. All right, let's see if there are any questions. I don't see any questions, but if you do have any questions, you guys can reach out to us. You can call us at 818-600-2034, 818-600-2034. You can call us to schedule free evaluation for ketamine-assisted psychotherapy. Dr. Reader is going to be available for the free evaluation. You can also go to our website and submit your request. Go to www.neurotherapy.com/KAP, KAP. Also follow us on Facebook and Instagram for latest news or webinars or any updates or even any possible offers as well. And let me see if I can put here a form and how to qualify for ketamine-assisted psychotherapy. You can also fill out that form either through this page, or again, you can fill it out on our website. Everything is going to come to us. We're going to respond to you. I will give you a call back with maybe additional questions. But anybody giving you last chance right now to ask any questions? If not, we're just going to wrap up our webinar. Thank you very much, Dr. Reeder, for your time and really education. That was an educational webinar about psychotherapy and ketamine altogether, CAP. Dr. Reeder, thank you so much.
Thanks. Bye.
Okay. All right. Thank you very much, you guys. I don't see any more questions. So again, reach out to us, 818-600-2034, or through our website at newyouTherapy.com. Thank you. Bye-bye.